The Goldsmith Fellowship was a pleasant surprise.
Finding out about the scholarship, at first I thought it was a typo.
The moment I found out that I had received the Goldsmith Fellowship, I immediately called my mother. My mom had been very concerned about attending graduate school. How was I going to pay for it? She didn't have to worry about that, and neither did I.
The Goldsmith Fellowship allowed me to not think about the financial aspects of my studies. It opened a number of options, including public health options and a career in academia.
10 years later, I'm not saddled with student debt. I could focus on my studies and I didn't have to take on a job. I could just be a student.
This extra time, thanks to the fellowship, I can cultivate these relationships. I can build that community. Just in one of my classes, there are probably 12 different nationalities. There's this exchange of knowledge that really just enriches the experience overall. It kind of helps you think of better ways to approach your work or better and more efficient ways to interact with your patients.
Our hope is that students who receive this fellowship will be able to stay in the field, graduate without other obligation of educational debt, and will devote themselves to public health. And if they don't, they're in trouble.
Without public health professionals, I think it would be a very bleak picture.
There would be no one out there monitoring for upticks in disease or outbreaks.
Imagine the quality of air in Boston would have been without the Clean Air Act in the 1970s.
It's become an issue of national security, how we respond to illnesses, whether it's the flu, Ebola, or even germ warfare.
Everything is public health, whether it's issues with incarceration, queer health, access to affordable housing. It all plays a role in someone's ability to be a contributing member of society.
I've always had an interest in public health because of the preventative nature, and I guess I was brought up to prevent things. So that was the area that intrigued me as opposed to basic medicine.
We were involved and supportive of Harvard University, and we were really pleased that Harvard was interested in supporting an expanded school of public health, and that's what we wanted to help. You have all very bright students coming from a variety of backgrounds and experiences. So you can't ask people to carry student debt and also go into this field, which is not handsomely paid, but of tremendous public benefit.
And we want to attract students not only who can afford to attend, but also who cannot afford to attend. By helping them come, we're furthering the field and making it more viable and stronger, not only in the US, but really around the world.
My current area of research is cardiovascular disease prevention, mostly in developing countries, and determinants of hypertension, for example, in Tanzania. We have looked at, in Uganda, the interaction between HIV and cardiovascular disease. A lot of low and middle income countries are now dealing with cardiovascular diseases and diabetes.
I'm a biostatistician at Boston Children's Hospital. I'm a numbers person, but it's important to help others who aren't biostatisticians understand what the data is telling us. So I work with clinicians and I help them answer their research questions. For example, about comparing two different interventions, which one can make children better faster. And we focus on trying to improve their medical outcomes, trying to get them off mechanical ventilators faster so they can return to breathing on their own, trying to get them out of pediatric intensive care units faster so that they can go home. But we're also following up with them when they're at home, that they have high quality of life, that they're physically healthy. They are healthy in terms of social health and emotional health and psychological health.
Currently, I'm in between my third and fourth year of med school. I'm taking a year off to pursue the degree in public health at Chan. So I think public health would help me be a better voice, a better champion for my patients, but also make a more wide-reaching change. Almost every single issue in public health comes back to the issue of poverty. You're asking bigger and bigger questions. I think that as a physician, it's my role to bring these big questions to the forefront.
I think for someone who is looking to create change in the world, helping train the next cadre of public health professionals and scientists gives you one of the best returns on investment. But they need support in order to implement those ideas. They need to focus on their studies and their projects.
I'd want donors to know about fellowships overall is just that I feel like because of the scholarship, I feel more inclined to pay it forward. So I'm trying to go out of my way to think of ways that I can give back to my Harvard community. As a donor, I feel like you get the opportunity to be that first domino who then incites someone to help someone else down the line.
Harvard aspires to develop leaders in the world, and certainly in the School of Public Health is contributing enormously to it. It is amazing over the years how many of the graduates do become leaders in public health in their own countries, and that has to make an enormous difference.